Hi, I'm George Mazurigos from Children's Hospital of Pittsburgh and the Starzone Network. Getting ready for your transplant can seem like a daunting challenge. We want to take some of the uncertainty and mystery away from it by letting you know what to expect after your transplant. Children have JP drains, central lines, and sometimes require drainage catheters called PTCs, or percutaneous transhepatic catheters. Our nurse educator, Marci Czachowski, is going to show you what those look like and what to expect.
Hi, I'm Marci Czachowski, the nurse educator at Children's Hospital of Pittsburgh. A central line may be required after your transplant. Today I'm going to be showing you how the nurses will care for and do a dressing change. A central line is an intravenous line that is placed in a large vein. Placement of these catheters is often needed for prolonged medication or nutrition administration. If your child's dressing is unocclusive or no longer sticking to their skin, it is best to sterilely change the dressing to avoid bacteria entering the insertion site and acquiring a central line-associated blood infection. To change central line dressing, gather these supplies: dressing change kit and a transparent dressing. Prepare supplies on sterile field by removing from packaging. Some kits may appear different from what we are using. Include 2 ChloraPrep swabs, chlorhexidine biopatch, Mastisol or any sticky adhesive, and skin prep to protect your child's skin. Step 1. Perform hand hygiene. Step 2. Clean area with an antibacterial or antimicrobial wipe to disinfect the surface. Step 3. Place mask on patient, self, second person if present, and anyone within 3 feet of patient during dressing change. Step 4. Open removal pack of dressing kit. Step 5. Perform hand hygiene with hand sanitizer. Step 6. Apply sterile gloves for dressing removal. Place first sterile glove on dominant hand, touching only the outer cuff, non-sterile portion, with your non-dominant hand. Place second sterile glove on non-dominant hand, ensuring to only touch the sterile portion of the glove with your dominant sterile hand. Step 7. Remove dressing from skin using an adhesive remover starting at the catheter lumens or bottom of dressing, then pulling away from the insertion site in an upward motion. Step 8. Remove old chlorhexidine patch if present. Note: only specially trained employees can change a stat lock or stabilization device. Do not change the stabilization device if there is one present and you are untrained. Step 9. Discard used supplies and remove gloves. Step 10. Open application pack in dressing kit. Step 11. Open and drop new sterile dressing onto sterile field. Make sure not to touch any part of the dressing until you are sterile. Step 12. Perform hand hygiene. Step 13. Put on sterile gloves. Place first sterile glove on dominant hand, touching only the outer cuff or non-sterile portion with your non-dominant hand. Place second sterile glove on non-dominant hand, ensuring to only touch the sterile portion of the glove with your dominant sterile hand. Step 14. Prepare supplies on sterile field by removing from packaging. Some kits may appear different from what we are using. Include 2 ChloraPrep swabs, chlorhexidine biopatch, Mastisol or any sticky adhesive, and skin prep to protect your child's skin. Step 15. Disinfect insertion site, any part of catheter that will be under the dressing, and any area that extend beyond the dressing in a basket weave motion, which is back and forth, up and down. Step 16. Scrub for 30 seconds using friction to disinfect the area. Step 17. Allow to air dry for a minimum of 30 seconds without fanning or blotting. This ensures if any bacteria are present, the skin will be properly disinfected. Step 18. Apply BioPatch or chlorhexidine patch to catheter insertion site. Remember, blue to the sky. Use in caution in patients less than 2 months of age. Step 19. Apply sticky or adhesive in a border outside the insertion site where the dressing will be. Step 20. Position dressing over insertion site using sterile technique as demonstrated. Do not touch adhesive or sticky portion of dressing to gloves. Step 21. Position small dressing piece under lumens overlapping large dressing, creating occlusive seal around the catheter without adhesive or sticky portion of dressing touching gloves. Step 22. Record date and initials directly on dressing. A child's central line dressing should be changed every 7 days or sooner if no longer adhering to the skin. Note, if your child had a stat lock or securement device present and you did not remove, the date on dressing should remain within 7 days of when the stat lock was last changed. A trained professional will change the dressing with the stat lock.